Okay, one thing that patients can have is actually something called Plica syndrome. And when your capsule forms embryonically, it starts as 3 small sacs and fuses into 1. And what's left over are the seams of where those capsules fuse together. And some people use the analogy of it's almost like shag carpet with the seams facing inward towards particularly the medial femoral condyle. So as a general rule, you have 3, maybe 4 seams. One of them runs vertically here, one runs across the top, and you might have another one laterally. The ones that seem to give people the most trouble are the medial plica and then the superior plica. You just want to palpate and see if that's the patient's pain generator. So to palpate the medial plica, you'll find some people actually kind of push the patella medially and kind of slacken the soft tissue while they do it. I don't necessarily think that that's essential. Many times I just do this, and I'm just right on medial femoral condyle here, and I'm just rubbing back and forth. Feel that?
A little bit, yeah.
Plica. And it's running vertically, and it feels like a little piece of angel hair pasta.
Yeah.
This is more like regular spaghetti. Okay. And then the one across the superior aspect runs horizontal. So then up here, you can sometimes find it right at your superior patellar pouch. I found it earlier, but now I can't find it. But if this is indeed the patient's pain generator, you have to think about why this is getting irritated. What are they doing that overuses it? Are their muscles tight? Do they have decreased soft tissue mobility? Do they have some increased swelling in the area? And why indeed that plica is getting irritated. So some people have palpable plica, some people don't. And if it is irritated, it will be painful upon palpation. So I can palpate Billy's right now and it doesn't bother him. He's aware of it, but it doesn't bother him. So clearly it's not a pain generator for him.